Hi, I'm Olivia, and this film shows you how doctors can help you when you're worried about the shape of your ears.
My name's Emma Murray, and I'm one of the plastic surgery doctors. Pleased to meet you. And this is Orla. Orla is one of our specialist nurses working in the psychology department, and she works within the plastic surgery team. So together, we're going to show everybody what happens when children who have concerns about prominent ears come to hospital to see a doctor.
What are prominent ears?
Some children have ears that stick out more than others, and we call those prominent ears.
Do many children have sticky out ears?
Absolutely, I can reassure you that the complaint of prominent ears is a very, very common one. So this is a picture of a normal ear. Now, in patients who have sticking out or prominent ears, they tend to have a lack of a fold here, so that the top of the ear appears flattened and can look as if it's sticking out. And the bowl area here sometimes pushes away slightly from the head, and more so in other children than others, again to create the appearance of a sticking out ear. Okay, we can also see that in these photographs here. Here are some examples. So this patient has a complete lack of this curvy fold. This patient has a bit of a fold here, but not as much as I do or this model does.
When children have prominent ears, does that mean they have a problem hearing?
No, children with prominent ears have normal hearing. Sometimes, however, prominent ears can attract unwanted attention, and this can lead to teasing.
Do many children get teased because of the shape of their ears?
Well, children can be teased for any reason, anything at all, from their hair to their shoes. But what's really important is how children respond to any teasing questions or comments.
Is there a best way to respond?
Well, it's different for everybody, but there's a few strategies we can use. So, for example, if somebody asks a child about their ears or makes a comment about their ears, they could simply say, "They're just ears." And that is showing the other children that actually, I'm okay. This isn't a problem for me, so it shouldn't be a problem for you. And there's other things like body language. That's really important. We know that as adults, but that's something we need to help children learn sometimes. That having head up, shoulders back, looking somebody in the eye and smiling can make all of us feel a little bit more confident.
What should children do if they're being teased?
One of the really important things to do is to talk about it, to tell somebody. So for example, if it's in school, telling teacher or guidance teacher, and especially telling mum, dad or somebody close to you so they can help you with it.
When children come to our clinic, we ask if we can take a look at their ears and examine them. So we can see here, Olivia, on your ear, that the normal curvy fold is slightly flattened and the bowl of your ear is slightly rotated away from your head. And this causes the appearance of a slightly sticking out ear. Now there is an operation that we can offer children who have prominent ears to set them back a bit and make them less prominent. So this is an operation called a prominent ear correction. We're going to put you to sleep for the operation so that you don't remember anything and that you don't feel anything. Mum and dad can come down to the operating room with you. Now when you're in the operating theatre, the operation takes us usually around 1.5 to 2 hours at most. When you're fast asleep, we make a small cut about this size behind the ear here. We then put some permanent stitches in to recreate that fold of the ear. We also put some stitches behind the bowl of the ear to help set the ear back a bit. Once we've done both sides, and after we've decided we're happy with the symmetry of the ears, we wrap the ears and the head up in a big head bandage.
Will it be sore when you wake up?
No. We put some special numbing medicine in around the ears once you're fast asleep so that when you wake up, you won't feel any pain in your ears.
When is a child able to go back to school? And when can they do sports after their operation?
Theoretically, a child could go back to school the day after their operation. However, we find that because of this big head bandage, most people like to wait until the head bandage has been removed, and that happens a week after your surgery. After the headband is removed, we'd ask that you wear a sports headband, which we would ask you to purchase yourself for 6 weeks, both at night and during any sports.
Can you go straight home after your operation?
Most children go home about 2 to 3 hours after the operation, once we're happy that they've had something to eat and drink and that they don't feel sick. Before you go home, we'll make an appointment for you to come back to our plastic surgery dressing clinic to see our nurses 1 week after your surgery.
After the operation, does the child have scars?
It's normal to have a short straight line scar behind the ear where we make the cut. This will initially be red, and with time it will fade to a pale fine white line. Occasionally we do see abnormal scarring behind the ear, and abnormal scars usually occur as raised red lumpy, uncomfortable or itchy scars that can continue to grow with time. This is quite unusual, but there are certain groups who are more prone to them than others. These include people with very fair skin or red hair, people with dark or Asian skin types, and those who have a history of bad scarring in the family.
Are there any risks involved with the surgery?
Some of the risks are common to any operation, and those include bleeding and bruising, infection, and wounds that can be slow to heal, or wounds that can split apart. Other than those general complications, there are some complications which are more specific to a prominent ear correction operation, and those include the permanent stitch that we put in the cartilage behind your ear working its way out through the skin. We would sometimes see that over time the ears, one or both ears, can drift back out again, and that happens in about 1 in 20 cases. And quite commonly, it's normal to have a bit of sensitivity in the ear, particularly in cold weather. Finally, there's a general anaesthetic itself, which the anaesthetist will chat to you about.
What's the best age for a child to have the surgery?
We normally like to wait until children are at least 5 years old before we undertake prominent ear correction, and that's for a multitude of reasons. Firstly, we like to make sure that the child themselves wants the surgery and is in control of the timing of it. And secondly, we want to make sure that the child is mature enough to be able to cope with these rather large head bandages. We understand that many parents are anxious to have prominent ears corrected before a child starts school, but in our experience, it's better that the child is in control of the timing of the surgery.
Do a lot of children choose to go ahead with the surgery?
Well, it's different for every child and every family, but what's really important is that we listen to what the children are telling us to see whether it's right for them to have the operation, or whether if it's the right time for them to have the operation, if at all. Are there any more questions that you have for me today?
No, thank you for filming with us today.
Oh, you're very welcome. It's been lovely to meet you both today.
Thank you very much.
Thank you.